Well, we will talking about another abnormal menstruation, amenorrhea. And amenorrhea is another very common symptom in gynecology clinic, and it can be caused by local or systemic lesions rather than diagnosis. There are two types of amenorrhea: primary amenorrhea and secondary amenorrhea. Primary amenorrhea refers to the absence of menses by age 14. There are two situations of secondary amenorrhea. One is that the previous normal menstrual cycle is 1 month and the absence for more than 6 months. The other is that the previous menstrual cycle is more than 2 months and the absence is more than 3 normal cycles are both secondary amenorrhea. The etiologies of the amenorrhea are very complex and diverse, so the etiologies diagnosis of the amenorrhea is most important. For the primary amenorrhea, often caused by the genetic or congenital defect, so about 30% primary amenorrhea be associated with the genital tract abnormalities. But for the secondary amenorrhea, the pathogenesis is complex, but the secondary amenorrhea is common in the clinic. So we mainly talking about secondary amenorrhea today, and we know the menses be controlled by the hypothalamic and the pituitary and the ovary axis. So every part of them has some problem can cause abnormal menses, including amenorrhea. And the uterine defect or dumb genital tract dysplasia or endocrine system disease can cause amenorrhea also. Of all etiology, the hypothalamic defect is most common. Of the hypothalamic defectors, and the psychogenic stress is the most common. And depression, tension, and worry can cause neuroendocrine disorders and then cause amenorrhea. The central nervous system is extremely sensitive to the sharp drop in weight, so the weight loss and anorexia nervosa can cause amenorrhea also. The release of GnRH and LH was suppressed after more exercises, caused no ovulation and no menses. And the congenital GnRH secretion defect can cause amenorrhea. Drugs and craniopharyngioma can cause amenorrhea also. For the pituitary defectors, amenorrhea, the pituitary infunction or the tumor is quite common. When we learn the complication of the liver, do you remember we talked about Schwann syndrome? That's the pituitary infunction amenorrhea, and cause the postpartum hemorrhagic shock. The pituitary secretes cell ischemic necrosis and resulting the low pituitary function. The character of Schwann syndrome, including amenorrhea, feral lactate, and loss of libido, hair loss, decreased breast size, etc. And the prolactin adenoma is one type of pituitary tumor can cause amenorrhea. Ovarian failure amenorrhea, and because the ovarian secretion of sex hormone level is low, the endometrium does not have the periodic change and cause the amenorrhea. There are several types of disease can cause the ovarian failure. And today we will talking about the premature ovarian failure and the polycystic ovarian syndrome. Premature ovarian failure refers to women amenorrhea before 40 years old. cause ovarian failure due to ovarian follicular depletion or iatrogenic injury. The exact etiology is not very clear, but we know it is related to the genetic factors, autoimmune disease, iatrogenic injury, or idiopathic cause. Ovarian functional tumor can cause amenorrhea, such as cytolytic cell tumor and granulosa sickle cell tumor. About the uterine defectors, the Asherman syndrome and the cervical adhesion and the stenosis is most common, and diagnostic and curettage can damage the endometrium and get the infection and lead to the adhesion of the uterus. This is the adhesion of the uterine cavity we can see under hysteroscopy. And we cannot see the opening of the fallopian tube, but on both of sides. And this one is peripheral adhesion. And this one is central adhesion. Diagnosis. The most important part of the diagnosis of amenorrhea is the etiology diagnosis. And the first things we must perquisition about the medical history, including menstrual history and childbearing history, reproductive history, birth defect or other disease, and the family history. Detailed physical examination, including the development of the whole body and the internal and the external genitalia and the secondary sexual characteristics. Assistant examination about amenorrhea. The first things that we must exclude the pregnancy, and then we can do the drug withdrawal test. The first step of this step is the progesterone hormone test. Then we will talk how to do the progesterone hormone test. We give the patient the progesterone for 5 to 10 days and then stop taking the medicine. The patient will menstruate within 1 week. It means that there is no problem with the uterus. There is ovarian failure, and at the same time, the patient has enough estrogen level. If there is no menstruation, it means there's no enough estrogen level in the patient, or there is uterine defects. Then we must go to the second step, estrogen progesterone hormone sequential test. This test is to simulate the artificial menstruation cycle to the patient. If the patient has menstruation after the drug withdrawal, it means that the uterus has no problem. The problem at the hypothalamic, pituitary, and the ovarian axis. If there is no menstruation after the drug withdrawal, it means that is the uterus defects. And we also can do the pituitary gland stimulation test to make sure if the hypothalamic or pituitary have some problem. Hormone determination can understand the patient's endocrine function of hypothalamic, pituitary, ovarian axis. And the pelvic ultrasound, the hysterosalpingography or the CT and MR can make sure if the patient has some structural lesions. Hysteroscopy is a common examination to diagnose whether there is structural lesion in the uterine cavity. and the sex chromosome examination is also an important examination for the primary amenorrhea. The treatment of amenorrhea is aimed at the treatment of etiology. For the hormonal therapy, the estrogen replaced therapy can use to the patient without uterus, and the estrogen and progesterone hormone artificial psychotherapy can applicable to the patient with the uterus, and the progesterone therapy can use to the patient with endogenous estrogen levels. And the different disease, the treatment is different also. If the patient has structural lesions, we can do the surgery such as genital malformations, Asherman syndrome, or cervical stenosis and adhesion or tumor. Summary: primary amenorrhea refers to absence of menses by 14 years old. Hypothalamic defect is the most common reason of the secondary amenorrhea. Etiology diagnosis is the most important of the amenorrhea. Now there's some practice for you. Which one is correct? We see the patient, 45 years old, and the period is prolonged and the bleeding heavy with anemia. And the gynecologic examination, the size of the uterus as large as pregnancy 2 months, and the fundus of the uterus is unsmooth. And how about the diagnosis of this patient? Maybe. So the most likely diagnosis of this patient is uterine fibrosis, and the uterine fibrosis with the abnormal maturation and the anemia, the medicine therapy does not work. So C is correct. Now let's see the second case. Which one is your answer? We see this patient is 45 years old and irregular bleeding for half years, and the endometrial pathology is complex hyperplasia. And the endometrial complex hyperplasia means the patient's endometrium is stimulated by single estrogen for a long time, so we cannot use the estrogen at this time. Only progesterone can be used for treatment. So A and B is not correct. And the risk of endometrial cancer in patients over 45 years old with endometrial complex hyperplasia is 3 times that of young women under 45 years old. So we can choose hysterectomy for the patients over 45 years old. And this type of patients and the next is no problem, so we do not need to do the appendectomy. So the E is correct. Then for the third case, which one is correct? And this patient is 49 years old, and the menses occurs too frequent, and the period is prolonged, and now is heavy bleeding for 10 days. So now the diagnostic and the cutaneous can start the bleeding and get the pathologic diagnosis. D is correct. Now the last case. And this patient is the secondary amenorrhea after the delivery, and she has the postpartum bleeding history. And we have Lamb syndrome. Same syndrome causes the postpartum hemorrhagic shock. The pituitary secretes cell ischemic necrosis, resulting in low pituitary function. So C is correct. Today is our last course in obstetrics and gynecology. If you have any questions, can add me on WeChat anytime. Have a good day for all of you. Thank you.